Hi, my name is Dr. Dominique Paradis, and I am one of the naturopathic doctors here at Flow. I want to say a sincere thank you for joining us at the M Factor screening. We hope that you had a good time and were able to get some valuable information from this documentary. The topic for this week in our Menopause Mastermind is related to the importance of exercise during this transition. I am going to briefly discuss what types of exercises are important and why, what are some undervalued benefits of movement, and finally, I want to give you some pointers onto how safely introduce movement into your routine or how to increase the benefits you get from your already established routine so you can get more benefits if you're already active. One of the most important things I wish every woman, regardless of their season of life, would do is lifting weights. There, I said it. Why is this important, especially in perimenopause? During this period, fluctuating and eventually declining estrogen levels will have different impacts on your physical health. The first one is bone density. Bone density peaks when we are about 30 years old. Later on, our bones will continue to repair themselves to stay strong, but there will be a point, usually at the onset of perimenopause or early 40s, where the loss of bone density will start being more dominant than the capacity to continue repairing them. This will result in loss of bone density, which will affect strength and increase our risk of fractures and osteoporosis. Strength training is important because challenging our bones with a load will help maintain that repair mechanism. Strength is also important for mobility, balance, and stability. Why do we need strength, you may ask? Well, let me give you some examples. To be able to pick up grocery bags from the ground or from your car trunk. To be able to go up and down stairs or sitting on the toilet without issues. For other people, it might be having the ability to play and lift your children or grandchildren. Those might seem trivial examples, but when your mobility or your strength are reduced, those can significantly impact what you can actually do. The second impact of declining estrogen levels is loss of muscle mass. During the perimenopause transition, as well as for hormonal fluctuations, women often notice changes on the skin, as well as redistribution of adipose tissue from around the hips to the abdomen area. This leads to an increase in visceral fat, which is the type of fat that can increase your risk of cardiovascular disease, can increase your cholesterol levels, and blood sugar dysregulation, just name a few. There is this myth that is going around a lot that I think is important to mention here. This myth pertains to our metabolism slowing down with age or with hormonal fluctuations. Unfortunately, that is not really the case. There are many factors that can impact our metabolism, and some are determined by genetics. However, there's a lot that we can influence, whether with our lifestyle or habit. What the research shows is actually in the perimenopause period, there is a decline in overall physical activity, an increase in sedentary behavior, and also an increase in total calorie intake. This in turn can lead to the loss of muscle mass. An important player in our metabolism is our basal metabolic rate. This is the amount of energy your body requires to maintain vital physiological function, and increasing your muscle mass is one of the most valuable ways to increase your basal metabolic rate. This in turn increases the amount of energy that your body requires on a daily basis. Let me use a metaphor to explain this. Think of your muscles as little energy manufacturers. The more you have, the more energy is required daily to keep those manufacturers going. Maintaining adequate muscle mass can also help prevent the development of sarcopenia, which is the loss of muscle mass associated with aging. It can also help prevent increase in visceral fat. It can help increase strength, balance, and also prevent falls. The second most important type of physical activity is anything that can elevate your heart rate. So why is integrating cardiovascular activity in your routine so important? With perimenopause, we see a significant shift in cholesterol levels and blood sugar regulation. Cardiovascular exercise plays an important role in preventing cardiovascular disease, namely by helping maintain a healthy blood pressure, cholesterol levels, and blood sugar levels as well. So far, we've talked about the importance of maintaining muscle mass and strength to support bone health, preventing falls and fractures, as well as reducing cardiovascular risk and preventing changes in body composition and weight gain. In this next section, I want to bring to your attention some of the often undervalued benefits of being physically active during this menopause transition. Maintaining a regular movement routine can have powerful benefits on your sleep quality. This includes sleep maintenance or the ability to sleep through the night. It can also help manage vasomotor symptoms such as hot flashes or night sweats. Improving sleep quality positively impact daytime energy levels and oftentimes can help mitigate mood changes associated with hormonal fluctuations. Physical activity can also support memory, cognition, and the ability to focus on important tasks. Finally, movement can also facilitate digestion as well. In this final section, I want to provide some guidance on where to start if this feels a little bit overwhelming for you. If you can retain anything from this video, let it be this. Any form or amount of movement done on a daily basis can provide benefits. Two things here. One, any type of movement is better than none. Second, whatever you can do consistently is your best bet. Now, let's dive into a bit more details. The Canadian Society of Exercise Physiology publishes general recommendations on physical activity. Those are minimum recommendations to maintain health. For all adults, they recommend doing strength training for a minimum of 2 to 3 times per week, working on the major muscle groups, which can be done by using compounded movements like squats, deadlifts, overhead press. They also recommend a minimum of 150 minutes of moderate to vigorous physical activity weekly. This can easily be broken down into smaller chunks of 30-50 minutes daily. Another recommendation they have added is, as much possible, limiting the amount of sedentary time. Now, where to start? I usually recommend patients to start with walks because it's fairly accessible, can be done anywhere, and requires very little to none equipment. From there, I encourage them to introduce strength training. This can be done with body weight movements at first. Then you can add in some balance, some single leg exercises, and ultimately some weights. If you are new to strength training, I strongly recommend you team up with either a personal trainer or a physiotherapist to help you learn to move safely and with proper form, obviously to avoid injuries. Another key factor here is progression. Your muscles, bones, ligaments, and tendons need time to adapt to new stimuli. They also need variety to continue to be challenged and continue to adapt. That means slowly increasing your repetitions, durations of workouts, and also your weights. Finally, you can go even further by adding more power-based movements like jumping, sprinting, etc. All right. I hope you got some valuable information from this video. I invite you to share with your friends and family if you think that they would benefit from that knowledge as well. Finally, we are here to help you. Have a wonderful day.